status could also contribute to PC, because PCOS is not only the androgen hormone being elevated, there's also a place of the insulin hormone being elevated, because the body then resists insulin. Insulin is like a vehicle that helps to carry glucose into the body, into the body's tissues and cells, because without energy cannot do work.
I was beginning to wonder the relationship between insulin and
there's a relationship.
PCOS. We used to look at it from the angle of maybe diabetes, insulin.
Not just that. When the body has more of insulin, then it will also begin to cause the release or production of the same androgen hormone. So you see, so that is where the counter effect comes in. So a lot of women that have PCOS, a lot of them are also overweight. So when you're addressing the same PCOS, you also address the issue of, insulin resistance by giving the person medication that will cause the body to be able to receive insulin into the body cells or tissues. Because how do you check? You check the blood sugar level. You want to know if the person has high blood sugar. Because high blood sugar means that insulin is not being used. Yeah, so you check for insulin. You also check for this hormone presence. And then ultimately you do a pelvic scan. That is where what gives a hallmark diagnosis. Pelvic scan looks at the woman's ovaries. Are they normal? Do they have polycystic ovaries? So when it has polycystic ovaries, it explains the condition of the PCOS. And then ultimately what it causes women is it lowers fertility. It also causes irregular menstrual cycles. Yeah, people with PCOS, they find it difficult to have irregular menstrual cycles. A lot of them. That is one particular symptom of PCOS.
Wow. All right. With these things you've mentioned, can you please open us up to some of the symptoms of PCOS?
Okay. One of the symptoms of PCOS, it's like I said, hirsutism. That is hair distributions all over the body. Maybe the chest, the jaws areas, sometimes on the legs too, because it's not normal for a woman to have that kind of, that's a male dominant features. Because like I said, the androgen hormone is what enables men to have these features. It's a male dominant hormone. It's not that the female does not have androgen, but in small quantity.
Yeah.
Just like for women are known to have more estrogen. For women, estrogen. So estrogen is what helps a woman to develop all those curvy features. It's also enables women to even ovulate. Without estrogen, the female body cannot ovulate biologically. It was enables women for their womb to implant an embryo. That is a female dominant hormone. So, and in the body of female, it is expected that women should have adequate levels of estrogen for her to function properly as a woman. For the man, it's androgen. Androgen is what makes them to have bulky muscles. It's what makes them to have the kind of voice that I have. It what makes men to perform sexually.
Of course.
It what makes men to be reproductive, for them to have adequate sperm count and motility or morphology. That is, but when a woman begins to have
so
possessed
much
that
of it,
hormone, it's not normal. It interferes with their conception ability. So one of the symptoms is hirsutism. Number 2 is acne. Number 3 is polycystic ovaries, but then you can't see those with your optical eyes. It has to be done through a pelvic scan or ultrasonography. And then weight gain too. Weight gain. So these are hallmark symptoms. When like as a doctor, if I'm in the clinic and I want to see a patient, let's say someone is coming towards me, a woman, and then I could make what is called a spot diagnosis.
Oh, really?
Yes, by just looking at this woman's body, and then when I see her...
That's why I'm asking some of these questions.
That is true. Like I think I have a relative that has that same problem. And how did she get to reach out to me? It was when she started experiencing irregular menstrual cycle. That was when she became bothered that she doesn't see her period every month. That is, like always skipping. Then I thought, okay, why not go do a scan? Let's see. And she came back with that report, PCOS. And then another point that you made is that this contraceptive that women use, the oral called Postina, that's another thing that can also cause irregular menstrual cycle, because when the body overuses it for, let's say, more than a year or 2 years, they are synthetic hormones. So what it does to the female body is to increase in quantity. When it increases in quantity, it disrupts the hormonal pattern. But a lot of women don't know. They think maybe because of it, they can buy it over the counter, and then it's approved by the FDA that they can freely take it. But then it has certain side effects too. Okay.
Yes, absolutely.
So those are the features of PCOS I just mentioned.
All right. Let's also talk about how it now generally impacts the reproductive health of most women. How does it impact the reproductive health?
Okay, PCOS is one of the causes of infertility. One of the causes of infertility, very common cause. So women with PCOS, they find it difficult getting pregnant. Okay, that's just the bottom line. They find it difficult getting pregnant. It's one of the issues why women go attend outpatient gynecology clinics or fertility clinics. It is, and here in Africa, it's a common challenge. Like I have patients that I'm actually treating at the moment with PCOS. Okay, but it doesn't mean that women with those challenges, they cannot get pregnant.
Of course.
They can get pregnant. What they need to do is to approach the challenge, approach it holistically. It's not just about taking just medical drugs, taking ovulation-inducing drugs. You need to think of how to correct the underlying cause.
Okay.
Okay, it has an underlying cause.
Okay.
Like I said, poor nutrition. And when I mean nutrition, food.
This underlying cause can be assumed to be risk factors.
Well, yes, risk factors.
Okay.
Nutritional issues. What you're eating may not be healthy. And what you're drinking too. And what are you drinking? Soft drinks, fizzy drinks, and they have sugars.
Sugar-sweetened beverages.
So sugar causes another problem to the pancreas. That is why you see insulin is going up too.
This is like a revelation, because one would be wondering, what's the relationship between, taking my chill drink, sweet sugar-sweetened beverage, alongside infertility? Nobody would ever want to associate these two. Like, how can I enjoy myself and it will be causing infertility? Generally impacts the reproductive health of most women. How does it impact the reproductive health?
Okay, PCOS is one of the causes of infertility. One of the causes of infertility, very common cause. So women with PCOS, they find it difficult getting pregnant. Okay, that's just the bottom line. They find it difficult getting pregnant. It's one of the issues why women go attend outpatient gynecology clinics or fertility clinics. It is, and here in Africa, it's a common challenge. Like I have patients that I'm actually treating at the moment with PCOS. Okay, but it doesn't mean that women with those challenges, they cannot get pregnant.
Of course.
They can get pregnant. What they need to do is to approach the challenge, approach it holistically. It's not just about taking just medical drugs, taking ovulation-inducing drugs. You need to think of how to correct the underlying cause.
Okay.
Okay, it has an underlying cause.
Okay.
Like I said, poor nutrition. And when I mean nutrition, food.
This underlying cause can be assumed to be risk factors.
Well, yes, risk factors.
Okay.
Nutritional issues. What you're eating may not be healthy. And what you're drinking too. And what are you drinking? Soft drinks, fizzy drinks, and they have sugars.
Sugar-sweetened beverages.
So sugar causes another problem to the pancreas. That is why you see insulin is going up too.
This is like a revelation, because one would be wondering, what's the relationship between, taking my chill drink, sweet sugar-sweetened beverage, alongside infertility? Nobody would ever want to associate these two. Like, how can I enjoy myself and it will be causing infertility? But I'm hearing that from you for the first time.
No, for real, but because that is what science is dynamic. There are usually new findings, new research information out there. So, and we need to doctors that seek for information. At least they are the ones that help their patient more by giving them up to date information. Like I'm talking to you now. I also have I have passion for what is called integrative medicine.
Awareness, okay.
And lifestyle modification.
Okay.
So I've done courses on lifestyle modification programs, and then it gave me deeper insight on how to help my patients with their nutrition. Because you need to think what we are eating is harming us. That's the truth. It's harming us. All those things that we eat to buy from grocery stores, they are not food.
We definitely need to have another segment talking about wellness and all of that. But now, there's another question that has been bothering me. Are there stages to PCOS? And if there are stages, at what stage does it lead to an ovulation?
Okay, if there are stages to PCOS, they're not actually stages to PCOS. It's just when a woman becomes diagnosed to have PCOS, even before she goes for medical examination, there ought to have been maybe a delay in trying to conceive if she's married already, or maybe as a single person, there ought to be delay in terms of menstruation. These are the two things that take women to the clinic. Okay, and then the anovulation is a medical term for lack of ovulation. So it is when she's making effort to conceive and is not forthcoming, because the androgen hormone, what it does is it doesn't really mature the ovaries like it's supposed to. Because of the elevation of the androgen hormone, it doesn't mature the ovary properly. It rather creates a lot of ovarian follicles that are immature. So such follicles, they can't ovulate. They're not mature enough to ovulate healthy eggs. You understand what I mean?
Absolutely.
So it is supposed to mature the ovaries, and then another hormone would then take over called the estrogen, which would then ripen the ovary properly, and then ovulation would happen. So the follicle just, it doesn't mature the follicles really well. It just, mature them halfway, and then the woman begins to struggle to conceive because of what? The immature, the lack of maturation of the follicle. That is what elevated androgen does to the female body. So that situation is actually called anovulation medically, because there's no ovulation.
Yes.
And when there's no ovulation, the body might not menstruate. There'll be lack of menstrual period.
Okay, but earlier you mentioned that presence of cyst is polycystic syndrome. So the question I want to ask again is, how do we understand cyst in the simplest of language?
Okay, cyst, it's the fluid-bearing sac. Just imagine what a sac is, a small sac bearing fluid. That is generally what a cyst is.
Okay.
A sac, a little sac bearing fluid inside. So that is what polycystic. Polycystic means there's a cyst that is bearing fluid inside. And in the terms of PCOS, those cysts are not properly mature.
Okay.
You understand what I mean? But that is just how to explain it in the simplest
Does it have any relationship with fibroid?
No. Fibroid is practically a tumor.
Okay.
It's a tumor, although not a cancerous tumor. It's a tumor, and that fibroid is being fed by estrogen hormone. It is estrogen hormone dominant. That's fibroid. It's not like the other one, the PCOS is. No. What causes fibroid is when there's an elevation in the hormone called estrogen of a woman. Sometimes too, science says it also could be inherited. That's fibroid. Yeah, it's could be inherited, and people that present with that condition, mostly African women. Okay, and down Caucasians.
Okay.
Yes.
Now, for this PCOS, now, are there age range that could be exposed or could be prone to PCOS? Are there age range, or anybody from reproductive age?
No, there's an age range. Anything from 20 and above.
Okay.
20 and above. For someone that's not actually.
Wow, someone that's young can actually have PCOS.
Yes, of course, from 20 and above. As long as this woman has begun to menstruate, she is liable to have PCOS.
Okay. So how long can one have PCOS before irregular menstruation begins to occur?
How long
could you already have PCOS before you start? Yes, those symptoms start, showing up.
Once the symptoms of PCOS becomes manifest in the body of a woman, that is the duration.
Oh, okay. So there's no, there are cases where sometimes you already have this health condition and it never gets to present itself in any way until you begin to experience some extreme part of it before you begin to experience the symptoms.
Those symptoms I mentioned, those are hallmark symptoms. The irregular menstrual cycle, that's number 1. 2, the hirsutism. Number 2. 3, the person has done a lab and then revealed the person has high blood sugar level. That's number 3. And then ultimately pelvic scan. And the pelvic scan is the last one, because a lot of women, they don't do scan until when they've tried to conceive and it's not coming
or something. Yes.
Okay, but then the number 1 there is irregular menstrual cycles. At least you should worry a woman. She should ask herself, why am I not seeing my period?
Singles don't ever get worried when they don't see their period. They'll be like,
They don't
Please let me rest from the painful.
Okay. Wow.
Painful experience.
That's interesting. That's interesting.
No, I'm just saying, those are the words that some people say on the street, because sometimes I get to ask people. The first time I heard of PCOS, I decided to, ask people questions. I asked, have you ever heard of PCOS? I was like, which one is PCOS? I was like, okay, do you get to experience regular menstruation? Like, it comes now, and if it does not come, thank God at least I'll not feel pain. I'm like, really? So long as I'm not pregnant, I'm not worried. So, there are those parts of it, and it calls to question as to how well do we take care of ourselves, our health, and how well do we watch and, pay so much observation to our own, health and how healthy we are. So most times I know most women don't even care until when it has become detrimental. I'm trying to have a baby and baby's not coming. So we start checking what is happening to me and what is wrong with me. That's why I had to ask that question. All right, now let's talk about the state of mind of the patients that you try to attend to who have PCOS. How do you even get to manage their mental well-being alongside PCOS?
I think someone said, where the body goes, the mind follows. Okay, right? Or where the mind goes, the body follows. Where the mind goes, the body follows. Okay, and now the thing is, our mind is very important to health. Something in the medicine called psychosomatic condition. Psychosomatism means that someone is ill, and then the person keeps taking pill. The person keeps taking medication, and the medication is not solving the problem. The mind could be a tool to heal that person. Let's say, for instance, now, let me use another example that you could relate. For instance, someone has diarrhea. You do know that diarrhea, that might not be due to maybe infection or microorganism. It could be due to emotions, how the person feels. It's called emotional diarrhea. Have you heard about emotional diarrhea?
No, that's
Let me give you another example, practical example. Way back in school, I don't know if you've had that experience. I think one or two persons have had that. Even I've had it in the past. Let's say suddenly you didn't read for an exam, and so you now heard something like exam is tomorrow. If you're not careful, you might even rush to the bathroom.
Okay. I think I've heard that before. That when some people have anxiety,
and they feel like they want to go and poo suddenly. That's emotional diarrhea. That's because of it's the mind. It's the mind. You understand, ba?
Absolutely.
So the mind is part of the healing process. You understand? So when it comes to PCOS, the mind also has to be employed. Especially if this person is trying to conceive. It's called mind-body science. Okay, mind-body science. The person trying to conceive, you need to first of all believe that you can be healed, that you can get better. You see? So when you start thinking that way, what they call neurochemicals, things like serotonin, endorphins, these are our endogenous healers in the body that helps the body to heal by releasing all those feel-good hormones, feel-good neurochemicals that helps the body to heal in the area of pain. It helps to address pain issues. That state of mind, it helps, it makes the body receptive to treatment. That is just the conclusion. It's about being positive about your condition too. You have to be positive.
I like that part where you said one has to be positive. If you want to get treatment, you have to be positive.
Yes.
Let's go on a quick break, and when we're done, we'll be talking more about the treatment options.
All
right, viewers, I hope you're enjoying the conversation. Let's go on a quick break. When we return, we'll continue the conversation. Stay with us. Welcome back. You're still watching Healthy Living, reaching you from nation's capital, Abuja, and we're still discussing with Dr. Gilbert Nnaji, and now we're moving to treatment of PCOS. All right, Dr. Gilbert, earlier you were talking about some of these anovulation here and there, and there are already a lot for us to understand, and it's really overwhelming. Now let's talk about how this PCOS can actually, the irregular menstrual cycle, how it can actually impact ovulation, especially when someone is considering family planning and conception at the same time.
Okay, how PCOS impacts ovulation?
Yes.
PCOS is, like I said, is a condition of a hormonal disorder, especially the androgen, okay, which presents with features of weight gain, okay, infertility,
yes,
irregular menstrual cycles. So women with those challenges, those are the issues that actually prevent conception. When I mentioned lack of menstruation,
irregular menstruation,
and then anovulation, that is inability to ovulate because of the interference of the elevated androgen in the body of this woman. It hinders the natural conception mechanism. So in that way, it actually reduces a woman's chances of getting pregnant. So what that one needs to do is to see a fertility doctor or a gynecologist, okay, and then get to be assessed, because you don't know. It's not enough for you to embark on self-medication spree and start buying all sort of online supplements online and all those things women they purchase from online social media platforms. You see a medical doctor, let him get your history, assess you, send you for some relevant and important laboratory tests so that he could make a diagnosis. So when a diagnosis is made, then the treatment could then be prescribed for you. That way you get results in what you're seeking for.
Okay, so we're looking at it from the angle of the timing for ovulation when it comes to conception, and then someone who wants to do family planning.
The timing for ovulation?
Yes.
I don't understand that.
Okay, now I'm asking, how will this irregular menstrual cycle impact ovulation? And when you're thinking of conception and planning to have, doing this regular family planning that hospitals tend to ask you to do?
When you say family planning is someone that is fertile, that is not battling with infertility.
Okay.
That is family planning.
Okay.
But this PCOS is already a challenge for a woman that's trying to conceive.
So it means that she has no reason to want to consider family planning.
No business.
Okay.
Because what's the goal of going for family planning? Is that you've had enough children and you no longer want to have children. But in PCOS, you're not even having one child. It hinders you from conceiving.
We used to think that when there are options for treatment, it simply means that we can talk about conception and we can talk about family planning.
Okay, let me come. When you talk about treatment, the treatment options for PCOS, okay, now it's broken into two types. First type is medical treatment for women with PCOS, medical treatment, and it includes taking drugs that will help the body to be receptive to insulin. There's already insulin resistance in that kind of person. So drugs that will help the body to be receptive to insulin hormone. Okay, that is because when there's so much of insulin in the body of a woman with PCOS, it indirectly causes more androgen hormone to be produced in the body of this woman through the ovaries. So there's another, you see the chain reaction. So you want to address that condition. That's number one, medical treatment. I don't want to mention the drugs here.
Yeah, of course.
Then number two, you also want to address the problem of irregular menstrual cycle. You want to address it so anybody's woman to be seeing her period. Because if a woman is not seeing her period, she won't conceive.
Okay.
She has to see her period to conceive. And then thirdly, you can then prescribe this woman ovulation inducing medication to enable this woman to ovulate. Because ovulation is just releasing an egg that the sperm will possibly fertilize and conception. So if she's not ovulating, you can't talk about pregnancy or conception.
Absolutely.
So these are the three things that could be addressed medically, and there are drugs for that. That's for medical treatment. And then two, natural treatment.
Okay.
Natural treatment. Okay. Natural treatment is in terms of the area of lifestyle modification. You want to prescribe exercise. It's a pillow. It's just a medication, exercise. You don't know because you don't buy it in the market.
Because we don't, people don't exercise until when it becomes really detrimental to their health.
For a woman that is overweight, you need to exercise now. You need to burn off those calories. It's a therapy. Exercise is a therapy. People should start seeing it like that. Because it's not free, because you don't purchase means that is not important. It's important. So exercise is one of the treatments when it comes to the natural treatment perspective. Then number two, you need to begin to address your diet.
Okay.
You need to stay away from processed food, canned food. Those are things that can introduce all those unhealthy substances into your body, like unhealthy fat, sugar, and all that. Okay, yes. That could harm your pancreas. That could also cause hormonal imbalance, like the high androgen. You need to look at your food. You need to embark on a healthy eating pattern. Take more veggies.
Okay.
Take balanced diet. Avoid sugars. And then number 3, hormonal therapy. So there are some drugs that can actually fix hormonal issues, like when there's so much of androgen, hormonal balancing drug, and they're available. You can take hormonal drugs. Okay, available. Some of them are in the market, and they have NAFDAC approval, and they're all natural. Okay, yes, they're all natural. We prescribe it in the clinic. Okay, so I have NAFDAC approval. So these are how to. And then, if possibly you have the person has access to a health coach, let's say a health coach in the area of healthy dieting, why not take advantage of that? They work. I have patients that have come out of PCOS and they've conceived.
Okay.
Yes.
So that means there's hope.
There's hope. There's hope. It's no longer those times people just stay in the dark. They don't have hope. They just look hopeless, and they start doing all sort of funny treatment to get pregnant. Now these things they are what people are taking advantage of now to conceive, and they are healthy. They are healthy. So why not?
Okay, because I had to ask if there's hope, because there's a lady I know that I didn't even know she had PCOS.
Okay.
But for goodness sake, she's so tiny, like you would barely be able to tell that. Because I'm looking at some of the symptoms you've mentioned, and I'm picturing her, I'm thinking about her as you've mentioned some of those symptoms. She's not hairy, she's slim, and I don't know, I didn't know about her menstrual cycle. So when she got married, we were talking, I was like, when's our baby coming? The usual thing with ladies always trying to hide their pregnancy. So I thought that was what she